Plastic and Reconstructive Surgery article. Title is Use of Autologous Adipose-Derived Stromal Vascular Fractions in Revision, Rhinoplasty for Severe Contractures in Asian Patients. Autologous adipose-derived stromal vascular fraction treatments have been shown to elicit anti-inflammatory, antifibrotic, immunomodulatory, angiogenic, and regenerative effects. Injections of adipose-derived stromal vascular fraction have been used to treat severely scarred tissues. Revision septal rhinoplasty was performed in 40 patients with severely contracted noses. Clinical outcomes and adverse events were compared between one group of patients treated with adjuvant adipose-derived stromal vascular fraction injections and a control group of patients treated with adjuvant 0.9% preservative-free saline injections. In the adipose-derived stromal vascular fraction group, nasal lengths were estimated at 4.2 plus or minus 0.2 centimeters at baseline to 5.1 plus or minus 0.2 centimeters at 18 months after revision septal rhinoplasty. The lengths of nasal tip projection improved from 2.2 plus or minus 0.2 centimeters at baseline to 2.9 plus or minus 0.1 centimeters 18 months after surgery. In addition, nasofrontal angles improved from 125.6 plus or minus 5.1 degrees at baseline to 128.1 plus or minus 4.8 degrees 18 months after surgery. Nasolabial angles in the adipose-derived stromal vascular fraction group were estimated at 105.8 plus or minus 6.5 degrees at baseline and 94.9 plus or minus 5.6 degrees 18 months after surgery. Of these, nasal length, nasal tip projection, and nasolabial angle, but not nasofrontal angle, values improved more in the adipose-derived stromal vascular fraction group than in the control group. Preoperative and postoperative adjuvant adipose-derived stromal vascular fraction treatment markedly improved the therapeutic outcomes of revision rhinoseptoplasty of severely contracted noses without major side effects. Thank you for watching Plastic and Reconstructive Surgery article.